Thank you, Senator Black. And we do have time for a second round of questioning. I do have a question from Senator Pate. Senator Pate, if you allow me, before I let you have the floor, I do have myself a question that has been on my mind, Monsieur Poirier, ever since you first talked, and so I want to ask you this question. You did mention you had this example, and in this study we are really not struggling, but we're really conscious of the different jurisdiction that are sometimes and decisions that are provincial, and we are studying this government response to a pandemic that covers all Canada. And so when you said a bit earlier, you mentioned that in some provinces calling the paramedics might come at a high cost, and some individual may choose not to do it because they can't. And it really resonated strongly with me because of the consequences that we know it can have. So my question to you and others can answer, this government in his response to COVID-19 has strongly committed to connect with the provinces and to help even in the jurisdiction that are not that are provincial. And so I'm just trying to get a sense if your organization and maybe Dr. Trump have a feel like this connection and this help is happening, and maybe give us some example that this response to the provinces is actually felt by your different organizations. Maybe Monsieur Poirier. You will have to unmute yourself, please.
My apologies there. It is an excellent question. There is data already out of New York City where the number of cardiac arrests have gone up as a consequence of people not paying attention to chest pain. And we're starting to see that anecdotally across the country in the larger urban municipalities where people are choosing not to for fear of COVID at the hospital, which is a very strange thought. But it is something that is within society at present. So I think there's a real concern about that. The other piece that I mentioned earlier about the cost across the country, it has always had kind of this nuanced impact on people. So in Ontario, an individual through the health insurance may pay no more than $50 for the paramedic to provide service, whereas in Alberta, Saskatchewan, New Brunswick, you can be paying hundreds of dollars depending on how far you've been transported. And I think that's a situation that I recognize it's a provincial responsibility, but it is one of those inequities in healthcare that I think is inappropriate. Thank you.
Sorry.
Yes, did you want to comment on that?
Unmute. Okay. So I have been told, I don't work in Prince Edward Island, but I've been told that the drug plan for Prince Edward Island is really quite minimal. In Ontario, once you're above 65, you get the majority of your prescriptions paid for. But a colleague told me that that is not the case in Prince Edward Island. And this particular worker, I believe she was a nurse, said she spent the majority of her days trying to figure out how to get people's medication paid for. Dr. Ditani probably knows this more than me, whether that's true. But so there are these wide disparities. So how do we find the balance between having provincial responsibility, but having some consistency from province to province? And that, again, is, I guess, a constitutional challenge, how we figure that out. The Society of Rural Physicians has been working with the licensing bodies about the possibility of having portable licenses, so that if I'm licensed in Ontario and there is there's a great need in La Loche, Saskatchewan for physicians, which there is not right now, that I could go and help there, but I don't have a Saskatchewan license. All the licenses are provincial. I wanted to say something about Indigenous Services Canada, because we have worked with them, and I think people feel generally quite positive. Tom Wong seems to be doing a great job. So he has been making surge plans for Indigenous communities, so that they get a big outbreak, any of them get big outbreaks. He has lists of people across the province, across the country, have volunteered to come up and help out. And he's done that through the various disciplines. I've been working in primarily for physicians, but I know he's also got people of other disciplines who have volunteered for that as well. But at this point, he kind of has to get them from the same province, right? So he can't take someone from Ontario to work in Saskatchewan. So that is also a bit of a challenge. Some of the licensing bodies are making it easier for the pandemic to move across. But for example, the Northwest Territories lightened things up, but they only made it for Alberta physicians. So I had a colleague from BC who wanted to go to the Northwest Territories. He couldn't because he was from BC and not from Alberta. Can I make one comment related to previous comments?
Yes,
okay.
Briefly, if you can.
Okay, I just wanted to say very briefly, I am very, very supportive of multidisciplinary care and that what everyone can contribute. One of the challenges that I find is the communication. So I'm very supportive that a pharmacist can see my patient and do things, but I don't get a communication of necessarily what was done. So then I see the patient the next time and I'm trying to figure it out, right? So as we get this multidisciplinary care going, which is great, we really have to work on how do we communicate among ourselves so we all understand what the other person is doing, and that's a big challenge.
Well, thank you for this. And Dr. Datani, I saw you nodding, and I know we have a lot of questions. So unless you have something specific to add, I would I would
okay.
go to the next speaker. No,
I was just going to say I agree, and we need our electronic health records to help us with that. But communication and documentation is important for all of us.
Sounds good.